Hi, I'm Valerie Powers-Smith, partner at SBMP Attorneys. We are proud to be the title sponsor of the Palm Springs Life and Coachella Valley Economic Partnership Series, The Economic Future of the Coachella Valley. Our firm is a full-service civil law firm with offices in Palm Springs, Orange County, San Diego, New Jersey, and New York. At SBMP, we are invested in the people and the quality of life in the Coachella Valley. Greater Palm Springs has long been a destination for health, medicine, and wellness. But how has the novel coronavirus impacted the local healthcare infrastructure? To discuss these critical issues, please welcome our moderator, Joe Wallace, CEO and Chief Innovation Officer at the Coachella Valley Economic Partnership.
Hello, and welcome to the economic future of the Coachella Valley. Today, our topic is health, medicine, and wellness. We have an excellent panel of experts, and today we'll start with Ken Wheat, Senior Vice President and CFO at Eisenhower Health. Then we will talk to Jenna LeComte-Hinely from HARC. And then we'll talk with Kim Samuwatari with Riverside University Health System Public Health. Hello, everyone.
Hi, Joe. Thanks for having me.
Hello.
Hi, Joe. Thank you for having me.
Wonderful. Thank you for agreeing to join. So Ken, let's get started and talk a little bit about how COVID-19 has impacted our medical industry here in the Coachella Valley. COVID-19 has forced many of us to learn how to work from home, and that goes for medicine too. How do you see telemedicine changing the way medical consultations are conducted in the future?
Well, let me say, Joe, we're already seeing that. We've seen that as part of the pandemic. So there were quite a few regulations that were loosened to allow health systems to provide for telehealth visits, and so once the pandemic hit, what we see, just to give perspective, we see about 500,000 unique patient visits within our physician clinics throughout the valley annually. And from the period April to June, we saw about 30% of those visits move to a telehealth environment. Now, since then, it has pulled back quite a bit, where most of our clinics are less than 15% in telehealth visits. Here, particularly in the Coachella Valley, we have kind of a unique population in being a retirement destination. So 65% of our payer mix is Medicare, and really what we've found so far is a preference to really get back to the office and see their physician and that patient-to-physician interaction. There's a lot of comfort, I think, in that visit with your physician. That said, we also, one aspect though that it is expanding care for us is, we have a large snowbird population out here, so telehealth has allowed our seasonal residents to actually continue their relationship with their local physician back home at their summer residence. So that is one expansion that we've seen that has continued throughout the summer. Honestly, I think for large urban metropolitan communities, you're going to see a much faster adoption from the community. I think it'll be a demand. We'll see it here, but I think really the technology right now for us, and I'll say this is probably health system centric, but a lot of health systems are in our boat, I believe. The technology from the telehealth system, right? The telehealth industry right now has not made that visit. At least for us, it's not that much more efficient than the in-person visit and bandwidth. Those are really two key factors. I think there's a lot of players out there now in the market, in the telehealth market. There are systems that are out now that are in development that will make that a lot more efficient visit from the telehealth. And as you see that develop, I think you'll see more demand from the greater population, even in our local market here, and also more acceptance amongst the provider community in terms of the physicians and other advanced providers. And from the bandwidth standpoint, it really opens up telehealth to nearly all medical specialties. So right now, just given the bandwidth limitations, there's some medical specialties in some areas of medicine that just really aren't open to telemedicine.
Yeah, bandwidth. That's music to my ears. We need it everywhere: medicine, education, business, and even going online for college. So, yeah, you make it happen, and people will use it. That's we have an unlimited appetite for data.
Absolutely.
And it's great. So, it's been a wild ride. I bet this has been the sixth. Probably these last 6 months have been the wildest ride in your career. If you could go back to March, assuming the government would let you, what would you do differently?
That's a tough question. I mean, I think, in hindsight, we've talked about it a bit here amongst the leadership. And one of the things in March really was our screening, patient population screening out of the gate. When there's a much heavier focus towards travel, international travel, and not really just a core focus on symptoms and testing. Really the testing strategy was just on symptomatic. And I think for the health system, we saw quite a few issues in not expanding that testing to all, at least patients coming into the hospital from an inpatient standpoint and maybe from a surgical standpoint. Because there were a lot of asymptomatic positive COVID patients that did end up spreading, within the health system. And that wasn't a population we were focused on testing. So the testing was primarily guidance at the time, and our adoption at the time was primarily focused on that symptomatic patient. So I think that's one area in hindsight that obviously, knowing what we know now, we would have handled a bit differently and maybe, helped minimize some of the spread. Other than that, that's really difficult because there's not a lot when we look back and knowing what we had, what we may have done differently. The biggest challenge that we had was with the pandemic was the availability of PPE, which everybody now knows what PPE is. It's all over, so I don't have to explain that. You used to have to explain that, but you don't really have to do that anymore because everybody knows what that is. Amazing.
It's going to be in everybody's Christmas stocking.
Yeah, exactly. Yeah, well, that's true. It may be. It very well may be. We're all going to have our stocks at home, right? Mm-hmm. But anyway, it was really, that was our biggest problem. Our biggest challenge was the availability of PPE. And in hindsight, looking back, there's not a lot we could change with that. Every health system in the country was immediately, pretty much out of the gate, getting every bit of PPE they could, buying every bit of PPE they could. So, we were reaching out and, every avenue you could. There were sellers all over and trying to track down sellers for PPE. I don't know of any strategy that, we could have had any differently than what we did. So there's not much we could have done there. So, I'd have to say, in hindsight, there's not a lot. As a health system, honestly, I feel pretty comfortable. We did a phenomenal job really in treating our COVID patients and protecting our employees and our non-COVID patients and our family and the families of those patients as well as we could. I think we did just a phenomenal job in doing that. So there's not a lot of hindsight 2020 look back that is real clear.
All right, thank you. Many of us seem to have forgotten that there's a presidential election coming up, and it's only about 8 weeks away. And one of the things that I think the candidates differ very much on is Medicare for all. And if that happened, how would it impact the hospitals?
Yeah, and we're kind of, it's kind of an interesting twist for here, at least for us, out here in the Valley, given the mix of our patient population. We're a little bit, the good news is that we're a little more prepared for that than most because of the mix of our population. We're 65% Medicare, and if you put Medi-Cal in there, we're another 15%. So we're 80% government pay as it is now from a payment system, and we are about 10 to 12% private pay, and the rest self-pay and some other non-contracted care. As a country, it would have a massive impact. So we're unique. I'd say the usual in most markets is probably 40% or less in terms of that Medicare population, that payer mix. And the primary impact, honestly, Joe, is economic. So the reality of it is that those payments for quote like services from private insurance are in most instances, in some markets, more than what I'm quoting, but those are about 200% of Medicare. So like service, the payment's twice as much, but yet, you're expending somewhat the same resource to produce that product. And so obviously there's a much higher margin on that business. So given that healthcare is, approaching 20% of GDP, I'd say economically across the country, it would have a profound impact. For us, yes, it would have a significant impact. So we do have, 10 to 12% private managed care pay, which is a much higher paying population. So from a margin standpoint, it would be significant for us as an institution. I'll say, you always say, I will say this, you hear a lot about the red tape and bureaucracy of Medicare, and governmental health care for all. But honestly, if we can get our claims, out to Medicare, out the door in a clean manner and get proper claims out there, they're actually one of the fastest, most efficient payers that we have. Dealing with some of the private managed care payers can sometimes be more challenging. So I don't have any concerns from that standpoint. I would say that it's purely an economic impact, and it would be a profound economic impact, especially given the importance of the healthcare community to our GDP. Those are some of the highest paying jobs in every community. And so the downstream impact of that would be tremendous.
That sounds like a lot of the hospitals, maybe not so much Eisenhower, would have to increase the price that they get from Medicare to even stay open. But if they don't have
that'd be great if we had that option, right, Joe? Yeah, we don't have the option of increasing the price from Medicare. So you kind of, they pay you what they're going to pay you. It's a fee schedule that's determined at HHS. So.
Yeah, that'd be a real problem because people can't operate on negative cash flow for long.
Right.
You might not go under, but a bunch of places in Middle America would.
Well, no. That 10 to 12% private pay for us is significant. So trust me, it would be a not a good impact here.
All right. Well, let's talk about something that's a little bit nicer and easier to get our hands around than Medicare for All. How will the availability of bandwidth, and you mentioned it earlier, how will that impact the business plans of hospitals in the future? If you had unlimited bandwidth, what would you do differently?
Well, you could. That's wide open. We could probably spend a half day talking about that impact, but it's coming. As we've said before, we're working right now on our plans to prepare for that quote 5G world. Some of our providers are already signaling 5G starting here in our market. For healthcare, it's a huge impact. It's as I mentioned earlier, from the telehealth standpoint, you open up really telehealth medicine for all specialties. That eases inpatient consults from a telehealth standpoint. You could have any specialty, your orthopedic surgeon, your neurosurgeon, your pulmonologist would then have the ability to have diagnostic quality images, monitoring equipment studies in near real time on remote devices, which right now are challenged in not being actually in the pipeline connected to the network in the hospital for some of those more volume-driven diagnostic studies, or either with private placed T1 lines in a private setting. You can do that as well, but it'll even expand that throughput from a T1 line capability as well. So it's really, it's unlimited. I think that the bandwidth expansion is also going to fast track adoption of home medicine from home monitoring devices both wearables and other medical equipment in the home, probably allowing people to get more of their care at home and stay at home longer from a long-term care standpoint. So I think that's really, once the bandwidth comes online and you get tremendous adoption, that's really going to fast track that industry to a large degree. In another area it's helping is just with AI and big data, machine learning capabilities. Where there's a electronic medical record, an EMR, and there's two main big players in the country. Cerner's one, and Epic is the other one. We happen to be an Epic institution. They have nearly almost 200 million unique MyChart, accounts around the country. They now have the ability with the expansion, and they will have a greater ability with the bandwidth expansion to really crunch that data, and that, in terms of looking at unique patient populations. And let's just take a current example, COVID. Where we are getting different feedback from different healthcare markets around the country as to something being effective or not. They can now take 100 million patient encounters and look at treatments across the country and understand in a much quicker fashion what's working, what's not working, what is the outcomes, for all patients on a particular protocol. So the bandwidth really facilitates that and allows a lot better, big data, machine learning, data crunch. So it's coming, and it's going to evolve quickly, and it is going to be expensive, but we'll have to adopt in that, at a reasonable pace. But I think it's very exciting. Everything is going to become connected in the IoT world, the Internet of Things world. So that's where we're headed.
All right. So last question, and you may have just answered it. Is there a silver lining to come from the lessons that we've had to learn to get through 2020? We're not through it yet.
Yeah, I mean, that's, it definitely, the push, the silver, a couple of silver linings, the push towards technology, the fast adoption, it's really kind of fast-tracked the country, especially on the telemedicine front. And it's not going back. I mean, that's definitely, everybody's heading that direction. Medicare is pushing that direction. Private payers are pushing that direction. So it certainly facilitated that. I'll have to say, I mean, just for community, well-being or peace of mind or security, this pandemic really pushed all your healthcare institutions into much better disaster preparedness. So one silver lining is it really forced everybody to, not just the health systems and the hospitals, but also the county and everybody to really work hard on very detailed disaster plans, from surge planning and what happens, under different scenarios, and really lay in place those critical guidelines of how you respond to the next, outbreak. So we're much better prepared from a disaster preparedness standpoint. That was a real disaster. We do drills all the time, whether it's an earthquake drill or other types of disaster drills all the time within the healthcare space. But this was a real crisis and a real drill that went on for some time. So it allowed us to really develop those skills, plans, and adopt. And, the other silver lining, I mean, to take away from business and to take away from some of that was just the, I would say, the camaraderie and the teamwork and the sense of family that came out of this pandemic, from both our internal healthcare, providers, and it really, honestly, brought out the best in everyone, I'll have to say. And then in our broader community, the outpouring of both emotional and economic support was phenomenal. I mean, it was just amazing what we received from the community. And it really brought everybody closer together. Our donor support was amazing during that time. So I think a silver lining was it really brought everybody a little bit closer together and made us a little bit more interdependent.
All right, that sounds great. And thank you very much, Ken. I appreciate you coming in and participating on this webinar, and stick around. We may have a long discussion at the end here too. So
Thanks, Joe.
all right, let's move on now to speaking of community health and data and things like that. I think we have the data diva of the desert here is Jenna LeComte-Hinely.
I might get that on a name tag or something, business cards. I think Joe just named me.
DDD, Data Diva of the Desert. You like it, don't you?
I do.
All right, so HARC, where you are the CEO, is the keeper and analyst of health data for the Coachella Valley. And now I think you're the keeper of all of the valley and not just half of the valley. And that's a good thing. And you have some truly brilliant analysts looking at our trends. And I'm glued to the books that you put out. So what trends are you seeing that are being altered by COVID-19?
That's a very good question. So the obvious one, right, is employment. Some of our cities, like for instance, if you take Desert Hot Springs as an example, in 2019, their unemployment rate was about 6%, and now it's almost 24%, right? So it's quadrupled in just a few short months. And a lot of people would say that's not, a health issue, but it truly is, right? The social determinants of health, like income and employment and education, often have a much bigger impact on health outcomes than things like, treatment or your medications or anything. So it's a huge deal. Anybody who's been unemployed can tell you it's so stressful, worrying about whether or not you're going to be able to pay the rent, buy your food. That's incredibly sort of time consuming. One of the phrases that is used is allostatic load. Just being that stressed all the time takes a toll on your physical health as well as your mental health. And our data supports that too. We were fortunate enough to get some funds from some really generous private donors to do a Coachella Valley COVID-19 needs assessment that we just released. It's available on our website for free. And one of the things that was really clear to me that I guess we all knew, but just quantifying it, was that of the people who were employed in January before this pandemic really took off, 1 in 5 of them had lost their jobs by June. So in 6 months, 1/5 just completely lost their jobs. It's 23% of the workforce that was employed is no longer. So that's a major, major trend that has changed. And not surprisingly, our study also showed that there was increased levels of psychological distress in our community due to fear or uncertainty. We have higher levels of loneliness, of depression, anxiety, people who are having trouble sleeping, whole 9 yards. And I think one of the important things to highlight there is that that psychological distress is disproportionately felt by people of color, right? The Black, Indigenous people of color have higher levels of anxiety, higher levels of difficulty sleeping. It's affecting people differently. And our health disparities here really showed that the people experiencing the most psychological distress are those who are low income, those who are people of color. That's who this is, not surprisingly, really the hardest for. We did some work for CVAG on homelessness and some evaluation on their homelessness prevention efforts. And I think one of the things that really stood out to me was that many people who become homeless, it's just that one thing happens, right? They're living paycheck to paycheck and someone gets sick or their car breaks down. And it just has this cascade of impacts, right, that just snowball into homelessness. And for many people, COVID-19 is that beginning of the snowball. It's very scary.
Yes. So from a health perspective, what are the biggest needs in the Coachella Valley, and have those needs changed in the last 6 months?
So again, going back to the social determinants of health, right, the income, we have in the Coachella Valley, we have such a unique environment in that we have some of the wealthiest people in the country living 20 miles from some of the poorest people in the country, right? And it's not something you see all over the place. So that is a big issue. And in our COVID-19 needs assessment, we asked what resources people were tapping into and what resources people needed. And the number one thing that came out was the food banks, right? So we are very fortunate to have Find Food Bank that is a fantastic support system. But man, are they getting tapped, right? Everybody is accessing this. And it's an amazing resource, and one that is keeping people from going hungry right now. So I'd say that's one of the biggest needs, right, is food support and healthy food support, because obesity is also a huge issue in our valley. In America as a whole, we're not unique in that way, but that, you can't be healthy. You can't be out enriching your health or the health of others if you don't have enough to eat, right? And it goes for kids. You can't learn in school if you're thinking about your hunger. You can't learn in your homeschool if you're worried about that. And many of our kids actually did rely really heavily on those meals that were provided at school. So this is a whole new ballgame. I think mental health too, I want to emphasize, I talked a little bit about the psychological distress, but even before the pandemic, our most recent data showed that 1/3 of our local adults had an emotional, mental, or behavioral problem that concerned them in the past year. Things like stress or anxiety or depression. That's a lot, 1 in 3. So, there's 4 of us on this call. I know I experienced it. And we've got almost 1/3 of adults have been diagnosed with a mental health disorder. And I think that's one of those needs that, because it can be very invisible, right? People don't talk about it, and they don't realize that others are struggling with that same thing. So unlike something like, a physical disability where people can see and make accommodations for, often you don't know what's going on in somebody's head. And unfortunately, we have some amazing healthcare providers here, but as I'm sure, Ken and Kim both know, we have a huge healthcare provider shortage across the board, primary care, but also mental health care. And so as a result, we had, and this was again, before COVID-19, 13% of our adults needed mental health care and couldn't get it in the past year. And that's really tough, right? We don't have enough providers. It's really hard to find anyone. And then if you do find somebody and you are insured with, say, Medi-Cal, and they don't take Medi-Cal, what do, right? How do you navigate that? So access to all types of care, but mental health care in particular, I think is a major need for our valley.
Yeah, I agree with you. There's you talk about the COVID-15, the COVID-20. I'm the COVID -20. I lost 20 pounds in the first couple of months because my mind tricked me into thinking I had the energy of an 18-year-old and the appetite of an 85-year-old. And so I had exactly the opposite of what's in the news, but it's also a mental response to what's been going on. Because, you see things on a personal level. I see companies in trouble that are gonna put 30, 40, or 100 people out of work, and it just consumes every moment, whether you're sleeping or not. So it's a real mess.
Absolutely. As soon as COVID-19 hit, and we're a nonprofit, and we're very fortunate, have to say a plug, both public health and Eisenhower have always been supporters, so thank you.
You have good sugar daddies.
But, it's tough. I have a very tiny company, right? There's 5 of us, but those are 5 people that rely on me for their employment. And the idea of laying off anybody is just heartbreaking and so stressful. So you got to be out there and hustle so that doesn't have to happen, and that's not possible for many. So
yeah, CVEP's 6 people, so I completely understand what you're talking about. So next question is, many residents in the Coachella Valley, and I'm included in this, we go to Mexico for medicine and even dental work, and some go for surgery. We do this because of the price differential. Do you think the pledges made by the Trump administration to level the playing field for prescription drugs with the rest of the world will amount to anything?
I honestly cannot. Our president seems to change his mind, and often it's not based on science or facts. So I have no idea of his future actions, but I can say that it's certainly necessary, right? When we did a study for the Southwest Riverside County Cancer Care Task Force, that really opened my eyes to how much cancer drugs can cost. And often for cancer patients, you need to be on these drugs for 5 years or so. I mean, and if you have hundreds and sometimes thousands of dollars of cost every single month for years and years, you're having to make that choice between, do I pay for my life-saving medication or do I pay my rent? And that stress of having that huge financial burden is not good for your recovery, right? You should not be worrying about that. So it's definitely something that's necessary. Here in the desert, I think we're very fortunate. Desert Cancer Foundation can assist some people who have cancer who are lower income and help pay for those prescriptions. But the fact that there's an entire foundation that's dedicated to that shows that this is a major, major issue. So I don't know if it will change, but I sure hope so. It's a tough balancing act though, right? You have to be able to support, the science to develop those drugs and to test them and make sure that they're safe. And that's not free. So it's a tough challenge, and far, far smarter people than me are working on that. And I hope that we figure something out.
Well, I'm not sure that there are any people who are far, far smarter than you. There are people who have different expertise than you. So, yeah. So Jenna, what do you see as some of the health-related issues today that are not necessarily coronavirus related?
So I mentioned this briefly, but obesity is still a big issue, right? More than half of our adults and almost half of our kids are overweight or obese. And I think we used to talk about this a lot. There used to be a lot of momentum around anti-obesity work, and it sort of dropped off a little bit. And I think that's because obesity on a population level is really hard to change. It's really hard to impact. And it's really discouraging if you've done all this work and it hasn't made a difference, but it doesn't mean it's gone away. And I think on that note, one of the things I find the most interesting is that the parents of the kids don't think their children are overweight or obese. And that is just a recipe for ensuring that the children stay overweight or obese, right? Because they're not the ones buying the groceries, it's their parents. And their parents aren't going to make lifestyle changes for the kids if they don't see a problem, especially for the younger kids. Like kindergartners, everyone thinks their kid is a normal weight. That's not true. Almost half of them are not. But you have this, it's baby fat, it's cute, it's, that sort of thing. So I think obesity remains a real strong issue. And it's not coronavirus related. I'm sure it doesn't help. I haven't seen any data linking obesity to poorer health outcomes with coronavirus, but it's linked to just about everything else in terms of poorer health outcomes. Our leading causes of death here are cancer and heart disease, and it's strongly linked to both of those. So despite the fact that it's a tough topic, it's something that takes real sustained behavior change, that remains an issue.
So this is the last question, because you're touching on something that came out last week. The CDC released something that basically said, 180,000 are attributed to have died from COVID, and 9,200 were exclusively COVID. The rest of them had something else going on, like what you were just talking about, obesity, diabetes, things like that. So has COVID exposed this in a way that we can start solving these problems?
That's a really good question. It's certainly not helping any of those problems, but maybe it is at least shining a light on the fact that, chronic disease management is something that is a major issue, and prevention, I think, is important. One of the things I love seeing is that I think more and more healthcare providers and hospital systems are focusing on this was before COVID, but socially focusing on those upstream factors, the things that can prevent you from getting diabetes, the things that can prevent you from having these chronic illnesses that then leave you vulnerable to something like COVID, right? So focusing again on those social determinants of health. Let's make sure everybody has a home and food and a good education that's affordable. Let's make sure we have jobs that pay a living wage. If we had all of those things in place, there would be far, far less poor health outcomes. We did some work with Kaiser, and it's amazing what income level is statistically related to. Things like, ER admissions for heart attacks. If you have a higher income in your community, you have fewer ER admissions. You have fewer asthma diagnoses. I mean, it just really is pervasive. So, I think what has been exacerbated, unfortunately, by the COVID crisis is that those who were at highest risk and those who were, the most disadvantaged are even more disproportionately impacted by the negative outcomes of this. If you're retired, you have a great house with air conditioning and a pool, it's not so hard to shelter in place. But if you live in a trailer with, 4 kids and your only source of income just disappeared, that's really stressful, right? And here in the desert, if you don't have air conditioning, oh my God, many of their solutions for people who don't have air conditioning have gone away because they were solutions like go to the mall, go to McDonald's and hang out in the play place. All of those are gone now. So, it's definitely been hardest on the people who were already disadvantaged.
Yeah, other people's air conditioning. Yeah, it's the same as other people's money in the desert in the summertime. Yeah, it's vital. Well, thank you very much, Jenna. This has been a great interview, and I appreciate you agreeing to be with us and stick around for the time whenever Kim has finished. So next, let's get Kim Samuwatari. I've never met you face to face, but I've probably been on 25 Zoom calls that you are the voice of the county with respect to health outcomes. And even though I've never met you, I have come to love and respect you for who you are and what you do. So a couple of weeks ago, I was privileged to be invited to a presentation that you made about the unintended consequences of things like lockdowns, layoffs, school closings. I've read all of these articles out there where they talk about where these are alluded to, but yours was the absolute best one of that nature that I've seen. So I'm gonna hand you the floor here. Tell us about that presentation and what your position and the Riverside County Health's position is with respect to the unintended consequences of the policies that are followed largely by our state, because all the states do different things.
Thank you, Joe. I appreciate that. And, it is a really important topic, and it blends perfectly to what Jenna was just saying with the social determinants of health. So when we look at the impacts of COVID-19, what we see in the news all the time are the number of people who are getting sick and the number of people who are dying. And while those are both important things for us to be tracking, and we certainly don't want to see any unnecessary death in our community, there are also indirect impacts from COVID-19. And so our team took a look at what those indirect impacts are and what impact they're having on the community. So things like closure of educational facilities. We know that there are disparities in educational attainment and having the ability to access the internet, having stability with devices being available all the time for kids. We know that school teachers are mandated reporters, and if kids are not there, there might be abuse or neglect that's going unreported. We also looked at things like the impacts of closures on certain sectors, right? So higher rates of unemployment, loss of income, essential services like the food banks that Jenna mentioned, really being stretched to be able to support their community. And then the other thing that is interesting is the delay in medical care. So we saw an increase in people who were delaying the calling 911, probably because they were afraid that it wasn't safe to go into the emergency room during the height of the COVID pandemic. And so they delayed that, and then there were ramifications from that delayed care and poor health outcomes. We also have heard anecdotally about people delaying their chronic disease care. So somebody who is diabetic maybe not going in and being managed as they were prior to COVID, and so again having poorer health outcomes because of that. So really looking at the indirect attributes of COVID-19 and social isolation, family violence and abuse, debt and housing insecurity, really how people live, work, play, and learn, and what impacts that has on their health. So I'll just give you a couple of quick numbers, if that's okay. We looked at the economic impacts: agricultural jobs down 21.3%, leisure and hospitality jobs down 32.9%. Those are two huge industries in the desert, and they've taken very, very hard hits as a result of COVID-19. Almost 39% of renters did not think that they would be able to make their next month's rent. So that's a huge impact. Again, going back to what Jenna was talking about, if you don't know how you are going to be able to pay your rent and keep a roof over your head, it really overwhelms you and makes everything more difficult. We also looked at things at household income and how that impacts. And so when you're talking about virtual school and people being able to do that successfully, so for people that have an income of more than 150,000, about 64% of them have internet connection, have devices available for their kids, and they have the infrastructure to be able to do that successfully. But when we go down to incomes of $35,000 or less, it's down around a quarter of the people have that kind of access. So that means 75% of the population that has an income of $35,000 or less doesn't have the ability to successfully do remote learning. And so that's a real challenge as we try to navigate having school for our children and doing it in a safe way. We've also looked at things like the impact of drug overdoses. And so we saw in our 15 to 24-year-olds specifically, in 2019, we had 47 fatal overdoses in that age range. But in 2020, so far year to date, we've already had 32. So we are on track to surpass what we saw in 2019. And so that's really, really concerning as we move forward, and certainly needs to be studied further in terms of the impacts, the behavioral health and mental health impacts of the pandemic on our young people. Along those same lines, we saw through our behavioral health program at the county, a 16% increase in people seeking mental health or substance use treatment services. So big increase there. And of those, 20% of them were in the desert region. So more increase in the desert region as well. Possible that that's related to the big impacts we're seeing on the job and industry out there. We also saw a 38% decrease in no-shows or cancellations. And so one could surmise from that people are in need of those services and keeping their appointments and really seeking help. So good and bad, right? Good that they're seeking help, keeping their appointments. Not so great that there's an increase in people who need those services. And then I'll just mention really briefly food and housing. In 2018, we said that our overall food insecurity rate was somewhere around 10%. Now in 2020, we're looking at about 16%. So a big increase in food insecurity. And again, we're seeing that impact at our food kitchens and those kinds of locations. And then the last thing I'll mention is just, and you touched on this briefly with the CDC report that came out. So when we look at our deaths in Riverside County from COVID-19, 37% of them did not have any underlying conditions. But for the 63% that did have underlying conditions, the ones that were most common were diabetes, hypertension, some kind of a serious heart condition. Those were the three most common. And so that continues to be something that we monitor. But I think really the big message is where people live, work, play, and learn really impacts health. And all of these things that we just talked about from a data perspective are showing the impact of those social determinants of health.
Thank you. That's wonderful. So the question I'd like to come back with now is, I don't think you were on our county call the other day. And the topic of the discussion was the new color-coded opening thing that came out. And Riverside County has that dreaded purple status, which means we can get our hair cut indoors. And that's about all we can do indoors, other than if it's inside of our own house. The overwhelming opinion of the people on the call was that given our numbers and given the 21 days that you have to stay compliant with the next level to achieve it, that Riverside County will never get out of the purple range until there's a vaccine, and it's been used for months. How bad will these things that you've talked about get if we can't open our economy until January, February, March, something like that?
Yeah, so great question, Joe. And I wish I had a crystal ball so that I could predict how COVID is going to progress in our community. I'm a little bit more optimistic. I do think that if people are masking and social distancing, staying home as much as possible, that we can get ahead of the virus eventually. I do think that a vaccine is going to be an important step in control. But at Public Health and with all of our partners out there, we're really working hard to identify cases and to increase testing. And once we identify cases, we kind of wrap a cocoon around them. And so anybody who may have been exposed, we want to quarantine them so that they're not spreading the disease. And so I think there's a couple of messages there. One is that we really need people to work with our contact tracers and provide information, because we are not calling to find out about immigration status, or we're not going to be punitive about where you've been. The only thing we want to do is interrupt disease transmission, because if we can reduce disease transmission and get our numbers down, we're going to be able to progress through those tiers and open our economy. I agree absolutely that it's important that we open our economy, and the business community has been fabulous at working with us and trying to do that in a safe measure, a safe way. And so we will continue down that path, absolutely. I do think the reality is that the longer the economy is closed, we will see increases in some of these indirect indicators of health outcomes that could be attributed to COVID-19 and to some of the lockdowns.
Right. So one last thing is, if you could go back to March, and you've talked about the CDC study and the percentages here, would you do things different? Like finding out, make sure that the people who have comorbidities really do lock down, because it seems like those are lives that could have, you can't really save them, but they may get 5 years instead of 5 weeks. So would that be something to try and push for, is identification of and locking down strategically of people who are most susceptible?
In retrospect, I think we have learned a lot throughout this whole process. It is hard when it's a novel virus, because we are learning as we go, and we're making decisions based on what we know at that particular point in time. I think overall, the response from a health perspective, a public health perspective, has been strong. I think the response from our healthcare community was absolutely amazing. And I think that the response from our community-based organizations has also been incredible. They've partnered with us every single step of the way. And so in terms of if I could go back and change things, one of the things that we do in public health and in emergency management with our partners is we go back after the conclusion of an event, and we really dissect every decision that was made and what were the pros and cons of that decision. And so that will be happening down the road, but we have been going at such a fast pace and new information coming at us every single day that we have been making the very best decisions that we can at the time with the information we have.
Yeah, exactly. It's kind of hard to design a new boat while you're bailing water out of the one that's going to sink you to the bottom of the ocean if you don't, isn't it? Well, thank you very much, Kim. I think we have a few minutes left, and what I'd kind of like to do is go back to Ken and let him make a closing statement on the thoughts, what he's heard, and then we'll go through Jenna and then come back to you, and that will be the end of this webisode. So Ken, what have you learned today, and what other things would you like to get to us?
Well, I mean, it certainly, it was interesting to hear some of the factors from both Jenna and Kim that at least their data is showing, and that we're seeing on our side as well. I guess the one of the biggest points that I concur and say, yeah, I can see that is on the mental health side. And Jenna spoke about the significant increase. We're definitely seeing that on our side as well. So it is impacting your healthcare provider institutions as well. And I think that's is a major issue for our community specifically. And I'm sure all communities, but I think we're unique to some degree. Not unique, but we have a real problem here. And I know that Riverside County as well has a lot of plans to address that. So I think, that was a real learning, statistic for me. And then just the food insecurity. Honestly, I didn't realize, I'll be honest, I didn't realize the percentages were as significant as what I'm hearing, and that, the percent of the population, the workforce that's out of work, I think I didn't realize how large that was either. And the percentage of renters that couldn't pay their rent. And so that was new to me. And we've got to get this thing back up and going. And I hope to be a little more optimistic like Kim, and that we can do that. And Joe, I know there is a lot of tension out there around the color-coded system, but hopefully we can have a more optimistic outlook. So that's it. But thanks for having me, Joe. I'm very happy to participate.
All right, Jenna.
I think, one of the things that Kim said was, I am so happy that we live in a county with a great healthcare providers like Eisenhower and great public health. Kim's leadership throughout this whole thing has been amazing. There are a lot of counties that haven't. and so I just think it could have been so much worse, because as Kim pointed out, we do have a unique community here, right? We have a lot of older people who are the most at risk. It could have been absolutely disastrous. And I'm not saying it's not disastrous. I'm just saying it could have been epically worse. And I do think that a lot of the things that are in place, the masking and that being mandatory and encouraging testing. I got tested this morning at a Riverside County site out in Indio. I think that is going to be important going forward, especially, I saw in the news that Desert Healthcare District is paying for these rapid testing, where, you can get your results in a few minutes rather than a week. And I think that is going to be critically important, because talking about those contact tracers, if it's already been a week and you finally test positive, and then you have to go back and think about, well, where was I a week ago? And you've already been in contact with a bunch of other people, that's a really, really tough thing to handle. And it's no single provider's fault. It's just absolutely the labs are overwhelmed, right? So I think the development of these rapid testing, if we can have rapid testing and have everybody get tested, and then, treat and isolate and wrap in the cocoon that was mentioned, that will be really, really key to controlling this. So I am also optimistic. There's a lot of scary stuff out there, but I think we are fortunate to be in a place with some really fantastic people working on this. So thank you for having me. I'm very honored to be, on the same panel as Ken and Kim, who I respect greatly. So thank you.
Well, you're all part of the survival and the recovery of this county. So, Kim, your final thoughts?
All right, I get to wrap it up, huh? Bring it home.
You do.
So I think the big takeaway for me in all of this is that we're in this together, right? Whether it's Ken and his hospital and treating patients and doing education, or Jenna and getting us good data so that we can make solid decisions, whether it's public health and the activities we're doing. There are community-based organizations that are doing outreach to all of those folks that are really high risk. Everybody is rolling up their sleeves and trying to help our community. And I think that is one of the amazing outcomes of a disaster, right? We see the best in people come out. So I think to really wrap it up, I just want to remind people to wash their hands, cover their face, stay 6 feet away from people, and stay home as much as you can so that we can get our arms around this virus and start to reopen up our economy.
Wonderful. Thank you very much, Kim. And those last things that you just said, that didn't come from your doctorate. That is pure common sense, and we should have all been doing it forever. So thank you to all of you, and You know, hopefully by the time this airs, we have a vaccine. Wouldn't that be wonderful?
Fingers crossed.
All right. Thank you.
Thank you so much.
Bye, Joe. Thanks a lot.
Thank you for having me.
On behalf of Palm Springs Life and the Coachella Valley Economic Partnership, we thank you for watching and would appreciate it if you send your feedback. We'll see you next week.
For Timo's Air Conditioning, the Valley is home, and customers are family. When we opened our doors in 1998, we had one mission: to serve you better every day. 2 decades later, that mission still stands. And when it comes to AC replacement, more homeowners choose Timo's over every competitor. Hard work, honest prices, and old school values. That's the Timo's way.